Hello, my name is Elliot Paz. I am a teaching assistant at Montana State University Northern. And for today's lecture, I'll be going over the Introduction to Kinesiology, Chapter 1, from the textbook of Introduction to Kinesiology, Studying Physical Activity by Dwayne V. Knudsen and Timothy A. Brousseau. And these slides have been adopted by Human Kinetics. All right, and so what we're going to be going over in this chapter is exploring the broad concept of physical activity, what it is and how important it is in human life, defining what physical activity means, and the different ways we can think about it. So we can start with more of a real world example, which may not fit into this, but still good food for thought. The introduction of esports. Since it does require fast perception and fine motor skills, but is it physical activity? Who can say? And another thing to note is begin looking at kinesiology as more of a discipline and see how it connects to physical activity. In addition, we're also going to be talking about the three sources of knowledge, I should say, related to physical activity. So those three sources can be broken down to as what you learn from doing physical activity, scholarly study, and then what you gain through professional experience. Those are your three areas. And then finally, we're going to be getting into what makes it a profession and look at possible careers related to physical activity. All right, so what has been causing an increase in the interest in the discipline of kinesiology? One thing to note, it has become one of the fastest growing majors in higher education. So despite the fact that college attendance is actually going to drop due to the low birth rates and the skepticism of higher education process and higher prices, kinesiology programs are the only programs to actually see an increase in attendance. This can be broken up probably the two main reasons: the great appreciation for the importance of physical activity and the growth in physical activity related professions. So, like an undergrad athletic training degree, a master's in physical therapy, which nowadays now is a doctorate, and OT, or occupational therapy, which was actually only a bachelor's back then. On top of that, historically, this degree honestly was only offered to physical education teachers and coaches, was way back in the 90s. But nowadays, a kinesiology department provides academic foundation for a career in health, fitness, sports science, rehabilitation, and more. So the overall general idea is that physical activity deserves to be studied as seriously as any other discipline, since this study can actually play into real world health effects. All right, so this little figure here, what I have is what I describe it. It's breaking apart the sciences into each of the respective disciplines. We'll go with that word. So this top part here, this red, you can see here, is sociology, and essentially what its discipline is the human social interaction. Then there's biology underneath, which is the study of life forms, anthropology, which is culture, and then kinesiology's little part of this discipline is the study of physical activity, which is the general area. So you know those three sources of knowledge I was talking about? Well, here they are now. So the first one we'll be talking about is the physical activity experience. So this can be learned where we actually by doing the actual physical activity, but also directly observing it. And sometimes which makes sense because say there's a new workout someone's doing and want to try it, you shouldn't actually try to see it like fully without seeing how it feels and then how to guide movements. Of course, keep in mind here there's still limits to the amount of knowledge personal experience has to offer. Because sometimes you may have a personal filter. Maybe this is something for you really enjoy, but maybe a lot of people don't. So keep that in mind. Then the next area is what we call the scholarship aspect. So if you're an undergrad right now, you're doing this already, more or less, once you get to your high level classes. So this can involve reading, researching, studying, and discussing theoretical and practical aspects of physical activity. So that could be an example. So maybe say in your classes you're doing modeling, so mathematical, physical models, imaging, predictive, and preventing injuries, experiments, laboratories, and publications. Those are all examples of what the scholarship aspect of this physical activity can be. And then finally, there's the professional practice. So this is when you're designing or implementing a physical activity program. And I guess the more in-depth way of putting this is how you said you're manipulating physical activity experiences of clients, patients, or whomever you're working with to meet their personal needs. So we can go through some examples. Let's do a college athlete and a college strength and conditioning coach. So for the strength and conditioning coach, sure, you may have developed a really good routine, but that's really not going to matter if the student's life is going to be very busy, which can be often the case. And of course, maybe instead of doing 2 hour long sessions, break that up to three 30-minute sessions. So that way it feels more manageable. And of course, on the college strength and conditioning example, say the bus breaks down or the coach decides to punish the players because someone did something stupid. Now you have to adjust your regimen on the fly. So having some give and take is going to be a general idea for this. And so the overall idea is know your individual and know the population. I'm not going to throw like a big, let's use a fun example. Say I'm going to put someone like through like a boxing, like a actual boxing workout, like getting them ready for a fight on someone who's just trying to be more casual and just want to have like a good sweat here and there because it's going to hurt. So you have to keep that in mind. Know the person's needs, know their goals, and design your regimens from there. All right, so now the thing is we have to define what is physical activity. So if we go a potential first definition, which is what we call the everyday language, the definition from there is that any form of muscle contraction is considered physical activity. However, the problem is that we need a technical definition, so individuals across university systems, disciplines, and other professions have some common understanding, so we're not all speaking differently. And plus, there's also the issue like, are we considering, say, a diaphragm contraction during a sneeze, or normal breathing physical activity, or even blinking? Which, for short answer, no, we're not going to be considering a physical activity. It's considered a movement, but not physical activity, which I'm going to get into in a quick second. So we have our second technical definition from Carl Newell that basically formulates physical activity as something that is intentional, voluntary movement aimed at achieving an identifiable goal. So I kind of mentioned for like the sneezing aspect, that's just a reflex. Your body's trying to get something out, and it's not intentional. No, it's a reflex. So, or it is intentional, yes, but it's not voluntary. It's just a reflex your body does. Same thing with breathing. It's all involuntary. It's also intentional, trying to keep you alive. But yeah, it's still considered a movement. And of course, more examples of what just is movement. It can be more breathing, blinking, reflexes, twitches, and stuff like that. Now, there's still different definitions of physical activity out there. So this is not going to be hopefully it shouldn't be too convoluted. So the CDC defines physical activity as any bodily movement produced by skeletal muscle that increases energy expenditure above a basal level. So this of course limits to physical activity to voluntary movements with a purpose, but this doesn't include skilled movements that require little energy expenditure. So like I was talking about earlier for the esports example, is that physical activity or not? That's the question. All right, so we talked about kinesiology a lot, but what exactly is it? So the definition we're using from the American Kinesiology Association, it defines kinesiology as an academic discipline focused on the study of physical activity, which means it's going to have an impact on health, society, and overall quality of life. So here, kinesiology just looks at more than just exercise or sport. Now, granted, those are parts of what it can look at. It's not the whole picture. Some other areas we can see kinesiology be focused in dance, since it involves bodily movements, oftentimes the music that convey messages and emotions, and is a form of physical activity that is common to all cultures. So it fulfills a requirement. It's intentional for a purpose. So it fits definition perfectly of physical activity. Then of course there's exercise, was more of a classic example. So obviously which can be used to improve health, appearance, or physical performance. And the break does down even further. So you have training which focuses on improving performance at a specific sport or job related task. Then there's health related, which focuses on maintaining proper bodily function and reducing risk of disease. And then cosmetic, which is training to reshape the body. So, like bodybuilding, for example. That's probably actually the only example, actually. Then the next area we can look at, or we call our fundamental movement patterns. So these are what we consider the human movement building blocks for activities. They are skill related and often utilize large muscles. So some examples of this can include running, catching, kicking, walking, and throwing. Then the next area is sport, referring to skilled movement organized with rules and framed by competition. And then therapy, which is can be broken explained as you're essentially using exercises that are specialized and individualized to restore physical capacities that were lost due to injury. So as you can see, this is a pretty wide focus for kinesiology. You have some more on the cultural aspect with dance, then the fitness aspect, which can be exercise, and maybe a bit of fundamentals, and of course health. We have therapy, which is the big one. So yeah, you have quite a bit of choices with kinesiology. All right, so now looking at kinesiology in your career, so one thing to keep in mind is an undergraduate degree in kinesiology can open the door to many career paths. So you can either go to graduate school, so set for a master's, and also advanced professions. And then some can actually prepare you directly to work in health, fitness, sport, or rehabilitation. So you actually have quite a bit few routes you want to go. So as someone who is trying to study kinesiology, the questions you need to ask yourself are what areas of study interest you the most? How prepared are you for right now for a career in physical activity? And what steps do I need to take to succeed in that career? So in this figure here, which I'm also blocking out some stuff, where you can see like down here, this bluish area, let me highlight it with the laser pointer. Like down here. So that's you getting your degree. And then from here, you have your graduate study. And I really can't see the rest of these, unfortunately. Hang on a sec. Nope, I can't zoom in. But on your own time, you can also take a look through and see where these branches lead to. And you can definitely tell, yeah, there's quite a few areas. And another thing to note is that sometimes kinesiology has been called by other names in different universities and programs. So, exercise and sports science, human performance, health and human performance, human movement science, sports science, exercise science, physical education, even nutrition. But all in all, these labels all point towards the same central idea study of human movement and physical activity. All right, and another aspect of kinesiology is considered a very holistic profession. So, in short, holistic means referring to the interdependence of mind, emotion, body, and spirit. So, all those factors I just mentioned, they all play together. So, we're not just our physical bodies, we also have our thoughts, emotions, and even spiritual dimensions that are intertwined and affect one another. So, say we're referencing dance, for example, of course, it's very physical, but also you have some emotions and there's even a spiritual aspect as well, depending on the culture. So, physical activity, it should be studied in ways that can also include a cognitive aspect. Essentially, put there are different levels of cognitive function. So, we say we do an agility drill. So, agility drill versus COD, which I do not have the notes for what that is. So, I'm going to some type of cognitive test. You're simply memorizing the path of the drill and repeating it. So, of course, the cognitive aspect of an agility drill involves players' ability to quickly perceive, process, and react to information to make effective decisions. So, then the next part on the emotional aspect, how does a movement make us feel? Say, if concept something like a nagging shoulder pain or nagging back pain, for example, a lot of times, yeah, it's probably going to irritate you, and of course, create psychological distress. And the best way to sum up the spiritual aspect of things, excuse me, is the meaning and purpose that we find through activity. Why do we dance? And why do we have competitive sports? So, and because of this holistic view, kinesiology is actually very unique among the sciences. All right, to wrap up our lecture, we'll be going over some professional issues in the field of kinesiology. So keep in mind, kinesiology is still relatively a new field, so there are still some standards that some do abide by, but then some do not. So some of the important issues are equality, making sure all groups have access and opportunity. There's evidence-based practice, which is using the best scientific knowledge to guide decisions. And then there's expertise, how to best develop the skills needed to be a trusted professional, or how to verify expertise, how far does expertise span, are they qualified to teach biomechanics, ex-phys, or nutrition? And then the question is, are they someone who is a jack of all trades, so they have a good coverage in multiple areas, or are they an expert only in one area, for example? And of course, we also have different scholarly journals that have different formatting standards with different various certifications, so like APA versus AMA, for example. So that's the best way. So, yeah.